The MTP joint is this joint here. This is the big toe, and it's a joint that affects, because most of the weight goes through this. Most commonly, it starts off with pain and discomfort. As time goes by, you get some arthritis, which is wear and tear of the joint, causing some permanent discomfort. The other thing that can be affected at this level of joint is called the bunion, which is a deformity. Well, not let's go into the bunion part, but sometimes the important part, you can have a bunion and you can have arthritis of the joint. Fusion of the joint is recommended when you have pain that is constant. So every time you're walking and every time you're doing your activity, it stops you from doing things because you got constant pain. I mean, everything else fail, which is changing your footwear, having a more comfortable job, more comfortable lifestyle, and still you can't get on top of the pain. You'd probably need to have something done surgically for it. At that stage, you have a full-blown arthritis. Your good option, I'm saying good because there are other options. The good option would be to fuse it. The unique part of this is not First MTP joint fusion. Lots of people do it. It's not rocket science. Most of them who have got surgical skill set can manage it. What is different is the way I do it. I fuse it, but I do it through minimal invasive surgery. You might ask me what that means. What that means is I do make small cuts in the skin, and I do the whole procedure through these small cuts. The advantage being that because it's only a small invasive procedure, your healing potential is quick, so you can get back on your feet quicker. Your risk of surgery, including infections, a bit of swelling and discomfort after the surgery, all minimal. And the surgical procedure itself is short, which means puts you less risk of other surgical risk. The standard recovery time after surgery, after fusion, is usually 6 weeks. So 6 weeks you go on minimal weight bearing, or some people put them on non-weight bearing, certain surgeons. But in my case, I just put you full weight bearing with a shoe for 4 weeks. After that, you can get back to your regular activities, up to 70% of your regular activities. You do need a surgical shoe, mainly because it gives you a hard surface to walk on for 4 weeks. That 4 weeks are restrict you from your regular activities, which includes driving. You can go to work if it's just an administration type of job. You can go to the toilet, bathroom, walk on your feet with full weight bearing for the 4 weeks. But after that, you can get back to normal activities. Again, this general quote, 9 out of 10 patients will be happy after a fusion. One being not happy because there's some surgical complications or things have not gone the way they wanted it to go. In my hands, I must say it's a bit better than 9 out of 10, but I would still keep to 9 out of 10 being happy after the surgery.